Hey, welcome back to the channel. Today's video is a little bit different because today's video is for the men. Now, I am fully aware that most of you watching are not that audience, but I'll bet you know someone in that audience that could benefit from understanding that we have created a Pilates program specifically for men. You know, men have overactive bladder just as often as women have overactive bladder. One thing men have that women don't experience, fortunately, are the bladder consequences of prostate surgery for prostate cancer. It's very common. A lot of men wind up leaking urine afterwards, and you know, it really bothers them. I know this is true because I see a lot of patients, and especially through my work at the Veterans Administration, I know men that have had prostate surgery and are now not able to exercise the way they want to or even move around without leaking are really bothered by this problem, and our results are clear. Pilates works for men just like it does for women. And if you'll share this video with them, if you'll sit them down, have them watch this video, they will understand there's something they can do. We have created the same online 2-hour self-paced webinar for $49 for men that also exists for women. They go to Pilates.com, click on the men's program right along the top there. You'll see a button that allows them to access the program, and they can start today. So anyway, I wanted to include in this video a couple of clips from my presentation, which is about a 30-minute presentation at the beginning of the Pilates for 49 program, this one for men. And of course, when they take the program, that's followed by 90 minutes of one-on-one instruction with Heather, our movement instructor, who's excellent. And she'll help them learn the movements, assess the movements, pick out the 2 best movements, give them a program, and get them started. So this is good news. Please, please share this video with loved ones, friends, colleagues, families, any guy you know that you think might benefit from it, and we'll make the world a little bit better. All right, thanks very much. Check out these clips and give us some feedback in the comments. Let us know what you think. Is there someone that you think could benefit from this? If so, just type it in the comments and let us know. If you haven't subscribed to the channel, make sure you do so. That would help us as well. And of course, like the video. Now, the pelvic floor muscles are kind of like a hammock. They go from the pubic bone, which is here, all the way to the tip of the tailbone, sometimes called the coccyx. And when the prostate is removed, you can see how close it is to the pelvic floor muscles. Well, it's close to the nerves as well. And if those nerves are damaged, it can weaken pelvic floor muscles, but as important, it can weaken the urethral sphincter, the circular muscle that surrounds this portion of the urethra and keeps the pressure in the urethra above the pressure in the bladder. If the nerves get damaged, the muscles get weak. And if the muscles get weak, the pressure in the urethra can decrease such that when you cough or sneeze or laugh, urine might escape from the bladder when you don't want it to. That's called stress incontinence. And it's common after prostate surgery for prostate cancer. So I want to show you a little bit about why we know that Pilates works and really how Pilates was developed. This wasn't guesswork. It was based on a lot of research studying the way muscles of movement interact with the pelvic floor that allowed us to choose certain movements that can be used to make a stronger, faster pelvic floor. And so what you're looking at here is called a Vessi clip. It's a 30 to 60 second recording whereby a subject, this person here, is going to perform one of the Pilates movements with the help of one of our instructors here. And she's wearing sensors, EMG sensors, electromyography sensors that record what muscles are doing, right? It records the electrical activity that the muscle produces when it contracts. So a higher EMG signal correlates with more of the muscle fibers within that muscle contracting, right? So a higher signal, stronger contraction. That's the idea. Now, over on the left side of the screen here, we see the pelvic floor tracing. And below that, This is from the gluteal muscles, and below that, the abdominal muscles, and finally, at the bottom here, are the inner thigh muscles. The idea is to get all of these muscles working together, and doing this kind of experiment over and over and over again allowed us to help identify which movements are best for which clients. Now we don't need to do that. We use the movement selection worksheet, which you all have, should download, print out before the movement section with Heather, so you can score each of the movements. It's going to help you pick the 2, maybe 3 movements that you're going to be performing 5 minutes in the morning and 5 minutes in the evening. So the clinical data using that same set of 100 consecutive patients from the Center for Pelvic Floor Medicine, we have some pretty encouraging results that are summarized on this slide. And so starting over here with this blue bar, we're looking at something called a global assessment question. That is, we would, after 28 days of training with the Pilates method, we would ask clients, how much better are you than when you started? If the problem was a 10, what's the problem now? The average response to that question was, I'm 50% better in 28 days. When we looked at pelvic floor strength, how strong that pelvic floor was contracting, we found that the average improvement in pelvic floor strength was a 62% improvement. Some of that may just be that they're getting more coordinated and getting better at recruiting the pelvic floor. Great, that's good too. These are the results we got just from the strength measurement test, and it's very encouraging that you can create that much more force in just 4 weeks of training. When you look at the number of times they're urinating every day, we call that voids. Daily voids decreased by 20% on average. For some people more, for some people less. Some of these clients had stress incontinence and really weren't that bothered by frequent urination. But on average, the number of voids per day decreased by 20%. UDI-6 and IIQ-7 are these validated symptom questionnaires used in research studying bladder problems, basically, and they indicate how bothered patients are by their bladder symptoms. So a lower score means they're less bothered. And after 28 days of training, we saw a tremendous benefit. We saw a decrease in bother on UDI-6, 43%, on IIQ-7, 63% in just 28 days of training. And the number of times these clients were leaking on a daily basis decreased by 64% in just 28 days of training. People, you know what to do. Please share this video with someone you think can benefit from it. And we will be bringing you more content regularly. So again, make sure you're subscribed. We'll talk to you soon.